For the heart exam, I would start with looking at the patient's fingers and fingernails, looking for any vascular issue. I would also look at their lips to see if there's any cyanosis. I would then move on to observing the jugular vein, so I'd have them turn their head away. I would use a light and shine obliquely just to find the pulse. And once I find it, I would place a ruler on his sternal angle and then have a perpendicular flat point, horizontal point, and cross it with the vertical ruler to find the measurement of the chest. And then I would then move on just to observing the chest and all the landmarks, seeing if there's any abnormal pulses that I can visually see. Then I would look for the apical pulse. Just visually see it on the left side. And then once I have located it, I'm just going to palpate that. Sorry, my fingers are cold.
Yeah.
And then I'm also going to palpate all the other valves, the aortic. I'm going to feel for any thrills or abnormal amplitudes. And pulmonic. I could feel herbs, but it's not necessary. And then the tricuspid and mitral. Then I could also just auscultate with him already laying down those same valves. Start with the diaphragm and do the aortic, pulmonic, herbs, that's just all the sounds of the valves, tricuspid, and mitral. A special test I could do while he's laying down is also look for MVP, or the mitral valve prolapse. So I would have him kind of rotate 45 degrees on his side and have him breathe in and exhale all the way out and hold. For percussion, I would stand on this side and I'm going to pull up around the third or fourth intercostals. My hands are really cold, sorry. And percuss to find the borders of the heart, looking for the dull sound, or hearing the dull sound. So, yeah. I'm then going to have him sit up. And once again, I'm going to listen to the valves while he's sitting up. This time I'll use the bell since I already used diaphragm. And then while he's sitting up, I'll listen for aortic regurgitation. So I'll have him bear down, pretending like he's getting punched in the stomach, and I'll listen for any pew noise.